cases. Right now, there have been 58 reported measles cases in the U.S., with an outbreak showing up in the last couple of months, and that's catching the eyes of the CDC. Adrian Byrne, the Sedgwick County Health Department director, has some insight into the recent outbreak. Good afternoon, Adrian. How are you doing?
Good afternoon. I'm well, thank you.
Yeah, so this is, I should say, 58 doesn't sound like too much of an outbreak.
Well, it's concerning because already in 2024, we have surpassed the amount of cases that we had in 2023, if that helps frame the concern.
Yeah, and that's kind of what I've been seeing is we're on track. It's kind of been, measles has kind of been on the lull these past couple of years compared to, of course, the 2019 outbreak.
Correct. And we even had one in 2014 prior to that. So the risks are international travel when someone is not vaccinated, and the vaccine is 97% effective, which means there's that 3% that out of that could be vaccinated, but that is a very small percent. 97% protected is a very high percentage rate, and anyone really that is born before 1957 is considered to have immunities because of the amount of measles cases that they would have been exposed to prior to 1957.
Of course, and what I'm kind of seeing is the CDC is suggesting, if you're traveling with a younger kid, is that internationally to make sure that they're vaccinated for measles?
Yes, because typically someone would get the MMR, which is measles, mumps, and rubella, between 12 and 15 months of age, and then again 4 to 6 years before entering kindergarten. But when traveling internationally, since that puts people at higher risk, it's recommended that anyone 6 months and older be vaccinated.
Perfect. Now, there haven't been any reported cases in Kansas, correct? But there have been some in Missouri.
That is correct. And we would like to keep it that way because measles is one of the most highly contagious diseases that there are. And if we have a room full of unvaccinated people, 90% of them will become infected with measles.
All right. And I guess some questions that parents may have if they're sending their kids to school, is there anything to be worried about, I guess, if their kid is protected and vaccinated against potentially kids maybe that aren't vaccinated with for measles?
Well, the kindergarten rate of vaccination of kindergartners being up to date, is reducing. It's reduced 3% from 2019 year, and we really need 95% vaccine rate to really have that cocoon type of protection, and we have less than that, about 92, 93. But if their children are fully up to date, if they're up to date with all of their vaccines, but right now we're talking the MMR, if they're up to date on their measles vaccine, then they are protected. Now, again, there's that 3%, but there's little to worry about. But at the same time, it's important that we also remember ways to help prevent, and that's to, after being vaccinated, because that is the best way to prevent against any vaccine preventable disease is to be vaccinated. But we also have to remember, just like with any other virus, during flu season or whenever, that washing our hands really well is important, and keeping our hands and fingers away from our eyes, nose, and mouth. Now, measles is contagious enough that when we look at an area where there's been someone that has had measles, we look at a 2-hour window after they were wherever. So people become infected by breathing in infected air, contaminated air or touching a surface where someone potentially has coughed in their hand and put their hand either on a pen or some surface, and then someone touches it and then gives it a way in through their eyes, nose, or mouth.
Yeah, and this is very interesting too that we're talking about an outbreak in the U.S. because I know that previously measles was pretty much eliminated from the U.S.
Yes, it was, but with more exemptions occurring across the country, and some states differ and have additional exemptions, it has increased the vaccine preventable diseases because of people not, more people not being vaccinated.
Of course. All right. Well, thanks for joining us this afternoon, Adrian Burns, Health Director there here in Sedgwick County. Quick reminder, essentially you're saying vaccinate your kids.
Absolutely. And just to let people know that how measles starts, 1 to 2 weeks, how they would know potentially. So 1 to 2 weeks after someone is exposed and infected, they would develop flu-like symptoms. And then what differentiates measles from others is that within a 3 to 5 day period after their flu symptoms, they would begin to have a rash around the top of their head, around their hairline, and then it would travel down. So that is one of that telltale sign of measles. It would be important if someone sees that to contact their medical provider versus going in, because of how contagious measles is.
Yeah, thank you for that. All right. Well, thanks for joining us this afternoon, Adrian, once again.